A very good evening to everyone. On behalf of Walter Kluwer, a warm welcome to our speaker and attendees of this webinar under our MedicalEdge series. Our topic today is growth and development in children. Learning objectives of this topic from today's webinar is understand the development aspects in children, deviations from normal development, and neurological and psychological problems in children. Our speaker today is none other than Dr. Aruchami Lakshmanaswamy, who is Associate Professor, Department of Pediatrics, Coimbatore Medical College, Coimbatore, Tamil Nadu. Also, we'll be taking all questions at the end of the webinar, and I request you to please post all your questions in the Q&A panel of this event. We will try to address the maximum questions at the end. Please also provide your valuable feedback via link, which we will post in the chat section of this webinar. Now, we begin our session and hand over to Dr. Lakshmanaswamy and request him to please start sharing his screen.
Good evening, all of you. Hello?
Yes, sir, sir, we can hear you, sir. Can you please start sharing your screen, sir?
Sir, you are able to see this? PowerPoint, sir?
Sir, no, sir. Sir, your screen is not being shared right now. Can you go to the share link and share your desktop?
Desktop. Good evening, all of you. I am Dr. Lakshmanaswamy from Coimbatore Medical College. So today we will discuss growth and development. So growth is just an increase in size. So growth is just increase in size of the organs of the body, and it's a quantitative change. Development is maturation of functions, where is a qualitative change with functional physiological maturation of bodies taken into account. So normal growth, there are various phases where intrauterine growth will be fastest in the second and third trimester. In the first trimester, there is only multiplication of cells. From 2 cell stage, they will become millions of cells. In the second trimester, the cells will increase in size as well as number. In third trimester, there will increase in size of the cells. Almost all the cells will have been developed by the time.
Sir, you have to increase your. Sir, your slides are not changing, sir. Actually.
Sir.
Sir, you need to change your slides also once you finish the slide.
Okay.
Thank you, sir.
So in postnatal growth, this can be divided into 3 phases: infantile growth, childhood growth, and pubertal growth. So in the infantile growth is primarily dependent upon the nutrition and other factors like thyroid, bone metabolism, etc. Childhood growth will primarily depend upon the growth hormone, the thyroxine besides nutrition, and the pubertal growth depends on the sex steroids, which are the major determinants. And anthropometry is study of measurements of the human body. So what are the things we commonly use are weight, stature, head circumference, and chest circumference. And of course, from 1 to 5 years, mid-arm circumference, all those things we take into consideration. All these age-dependent factors will depend upon the age. So weight, height or length, head circumference, and chest circumference. These things you can say for this age, this should be expected. Age-independent factors, these are all the age-independent factors. This can be calculated independent of the age. So weight for height, mid-upper arm or height ratio, chest or head circumference ratio, mid-arm circumference, which is static from 1 to 5 years. Inflow thickness from 1 to 6 years, body mass index, Dugdale index, Endenberg index, Canavati index, Ponderal index, Kutless index, and raw Unsing criteria. So weight. So suppose the birth weight is 3 kg, the baby will lose weight for the first 7 days, then it will start to gain the weight. So by the 10th day, it will be the birth weight. So from the 10th day, it will gain 30 grams per day for the first 3 months. Then next 3 months, it will be 20 grams per day. So from 3 months to 12 years, the weight can be calculated by Beach formula. From 3 to 12 months, 1 to 6 years, and 7 to 12 years. We have 3 different formulas. which can have your mind. So there's a simple formula which I use in the OP, outpatient department, to have a rough estimation of the weight. Just remember odd numbers, 1, 3 and 5. Put 1 as age. So age plus 3 into 5 will give weight in pounds. Now 1 kg is equal to 2.2 pounds. So if you divide by 2.2, you will get weight in kg. So this is a simple formula which you can have in your mind, which you can use in your OP in emergencies from 2 to 12 years. From 7 to 12 years age, weight can be calculated as age into 3, age in years into 3. So the birth weight will double by 5 months, triple by 1 year, quadruples by 2 years of age. So also you can have in your mind. Doubles by 1 year for 5 months, triples by 1 year, and quadruples by 2 years of life. Length, when you will measure the length is in the newborn, less than 2 years, and bedridden patients. Using an infantometer, you can see in children. So here it is 50 centimeters. At birth it will be 50 centimeters. Then the rate will be halved by first year. So 50 by 2 is 25. So if I add the 25 to the birth length, it will be 75. In the second year, the growth will be half of the first year. So 25 by 2, it is 12.5. So we add that to 75, it will become 87. Thereby next year it will be half of the 12. It will be 6. From then it will be 6 centimeters every year. So remember this easily you can remember. At birth it will be 50 centimeters. At 1 year it will be half of the 50. The rate will be half of the 50. So 25 centimeters we have grown. So by next year half of that 12. By next year half of that. Then from then on, every year there will be 6 centimeters increase up to 12 years. If the growth is less than 4 centimeters per year, then you have to suspect growth hormone deficiency. So the height formula from 2 to 12 years is age in years into 6 plus 77. Head circumference at birth it will be 34 to 35. So by 2 months 38, 3 months 40, 4 months 41, 6 months 42, 1 year 45. You just have a close look. At birth is 35, 1 year is 45. So it has increased by 10 centimeters in 1 year. Observe this, the first 6 months, the growth will be rapid. So you can put even 1 centimeter per month in the first 6 months, 0.5 in the next 6 months. So the head circumference increase in such a ratio. And after that, the rate will come down. So by 2 years, it will be 47. By 5 years, it will be 50 to 51. Mid upper arm circumference. This is constant from 1 to 5 years. At birth, it will be 9 to 11 centimeters. And by the end of the first year of life, it will be 16 centimeters. So there will be increased fat in the upper arm in babies, newborn infants. This fat will be replaced by the growing muscle. So from 1 to 5 years, there will be no increase in the size of the mid upper arm, although the baby is increasing by weight, height, all those things. So the mid upper arm circumference remains constant from 1 to 5 years because the fat in the upper arm is replaced by the growing muscle. Now coming to the upper segment, lower segment ratio, just remember these important points. Birth is 1.7:1. By 7 years is 1.1:1. By 2 years, 3 years, 4 years, you just put inverse 4:3:2. So by 2 years is 1.4:1. By 3 years 1.3:1. 4 years 1.2:1. 7 years 1:1. And for we people it will be 0.9:1. So remember at birth and 7 years. Birth is 1.7:1. 7 years 1.1:1. 2, 3, 4, you just put as inverse. 2 years 1.4, 3 years 1.3, 4 years 1.2. So this is important to know whether it's a proportionate or disproportionate short stature. So the etiology of the short stature will vary depending upon whether it's proportionate or disproportionate. So it's important to know the stature whether it is normal or disproportionate. So these are the factors which will affect the postnatal growth, the age. So there are two rapid growth in infancy and during puberty. And other times the growth will be normal only. And boys will have small increase in height and weight compared to the girls. Dietary factors, the bottle feeding, faulty feeding techniques, late feeding, nutrition deficiencies will decrease the growth. Breastfeeding, balanced diet will have a positive effect. Education of parents. So they can understand the importance of nutrition and they can give a good nutritive food. They can take good care. So the education plays an important role in the postnatal growth. And environmental factors like physical and psychological situation, like factors like maternal deprivation, physical deprivation, family problems, broken families, they can affect the problem. Also the polluted area, some area where they are living, the conditions are very poor, then they also will affect the growth. Exercise, increase physical activities. Increase physical activity have a positive effect on the growth. You can just see the animals, no? Even at the young age, they'll be running here and there. So these activities will have a positive effect on the growth. So you have to allow the children to play. You should not restrict them to sit and study all the time and in the house. Actually, they have to play, go out and play. Then only have very good growth. Females will have an early growth spurt, but mean height and will be less than the boys. So familiar influences, whether the child is reared by parents, grandparents, or foster care. See, grandparents, they'll have more time to spend more care, and when the parents are going to work, no, so they'll have very good growth and very good psychological, mental development. So it is important to have a grandparents with you when you rear children. And geography influences like school, neighborhood, peer circle also will have the impact. When it is poor, the growth will be affected. And hereditary genetic factors, from Turner syndrome, Down syndrome, the growth will be low. Hormone factors, endocrine factors, again, growth hormone deficiency or thyroxine deficiency will affect the growth. And increased growth hormone will have positive growth. Yeah. So here I have given in a ABCD, it will be easy for you to remember. Then hygiene, poor hygiene will affect the growth. Infections will have negative growth. Injury to the growing epiphysis, repeated accidents, repeated injury to the epiphysis will have a negative impact on the growth. And income of the family will determine the quality of life, nutrition, etc. Coming to social factors, availability of the food. Suppose in Ethiopia, no availability of the food. Now it's right on Sri Lanka. So these things will affect the growth. Broken homes, lack of family support will have a negative impact. Climate, the growth is more in spring and low in summer. Cultural factors, the cultural taboos will affect the growth. Dietary and feeding habits also will affect. Suppose they have some taboos. Some persons will not take non-vegetarian. Some people will avoid egg like that. So those things will affect the growth. And economical levels, again, this also will decrease the purchase capacity. Education of the parents, emotional factors, and the family size. So more food to be less food with more persons to be sad, so less nutrition. Then geographic factors, housing conditions, and infections will have negative impact on the growth. So coming to the development, so it is always cephalocaudal direction. So first there will be head control, then baby will turn in the bed, then they will sit with support, then sit without support. So it will come in that order. So when one development is not there, suppose child is not sitting with support, the next development will not come. So always it is cephalocaudal in direction. And the corresponding primitive reflex will be lost to achieve the definitive milestone. Suppose there is an asymmetric tonic reflex. The child is trying to turn in the bed, that arm will extend. It will prevent the baby from turning to the other side. So up to 5 months, the baby cannot turn in the bed because of the presence of this asymmetric tonic reflex. So once the reflex disappears, they can turn in the bed. So usually this appears by 4 to 5 months. So like this, all the primitive reflexes should be lost before the corresponding milestone develops. For example, plantar grass, palmar grass, these should be disappearing before the child is able to walk or holding objects. And generalized mass activity for any stimulus should be replaced by more mature individual responses. So in the newborn, for anything the baby will move all the limbs. It's called generalized mass activity. If it is happy, it will move all the limbs. If it is having any pain, it will move all the limbs. So this generalized mass activity will be slowly going towards the individual responses. Suppose the pain that move the lower limbs like that. So corrected age should be used as a chronicle ages in a preterm babies. So suppose the baby is born 2 weeks prior to the expected date, then you have to reduce that for assessing the development. Then catch-up growth. You should know what is catch-up growth. So all the preterm babies will not be lacking throughout their life. So probably by about 1 year, they will catch up the growth of the term babies. So from then on, it will be equal to the term babies. So for this, you have to see whether there's a catch-up growth is there. And delay achieving single milestone should be noted. And this point you have to remember. See, it will be very difficult for you to remember the milestones. Now, many students say that it is very difficult to remember the milestones. So you just remember what you do immediately after you get up from the bed. From tomorrow morning, you just observe what you are doing immediately after you get up from the bed. First, you will open your eyes. Then you will look at your friend. You will see. Then if your friend is standing there, you will put a smile. Then you will be looking to the surroundings. Then you will slowly lift your head. Then you will turn in the bed. Then you will sit with support and sleep for some time. Then sit without support. Then slowly stand with support. Then stand without support. Then slowly walk unsteadily for few steps. Then you walk without support. From tomorrow, when you get up from the bed, you just observe this. This is what a child will do up to 1 year, that is 13 months. So, at 1 month of age, the child will look at you. He will see. Second month, it will smile. You just come from the head to foot. Eyes, it will see. 1 month. Second month, it will smile. Third month, it will turn the neck here and there and look at the surroundings. They will be interested in the surroundings. Fourth month, they lift the head. So for easy remembrance, remember head or neck, 4 letters. And turns in the bed or rolls in the bed by 5 months. 6th month, it will sit with the support. For you to remember this easily, 6 is curved. The 6 number is having a curved back. So when you sit with support, you will have a curved back. So sit with support like 6 by 6 months. See the letter 7, it is straight back. So when you sit without support, your back will be straight. So you will be sitting without support like 7. Then stand with support by 8. Stand without support by 9. Walk with support by 11. And walk without support by 13 months, not 12 months. So remember this. It will be very easy to remember. And from tomorrow, this is a homework. When you get up from the bed, you just say 1. Look at that. Put a smile. Put 2. Look at the surroundings. Put 3 like that. So it is very easy. What you do immediately after you get up from the bed, the child will develop up to 13 months of age. So, see, 1 month it sees. 2 months smells at the mother or smells at second person. Yes, you can remember. Second month smells at mother, smells at second person. Third month shows interest in surroundings like fan, toy, etc. This is remember fan, toy. So shows interest in everything. So fourth month, look at that capital letters. Head control. Then rolls over or turns in the bed. You just note the capital and bold letters. 5 letters, rolls over or turns in the bed. Sit with support with curved back by 6 months. 7th month, sit with support, without support. And 8th month, stand with support. 10th month, stand without support. So 10th month can stand alone. Okay? You just remember that letter 1, standing alone. So without support. So just remember 11. One is the stick, another is the child. So child will hold a stick and walk. So walk with support by 11 months. So by 13 months to 14 months, walk without support. So just remember without support, 14 letters. With support, 11 letters. And by 1 year, it will talk 1 to 2 words. The 12 months put us 1 to 2 words. So this is for a easy remembrance. 1 month, it will see. 2 months, it just come down, lips, smile. 3rd month, neck, it will turn here and there, interest in surroundings. 4th month, head control. 5 rolls over. 6 sit with support like 6, 7 sit without support like 7, 8 stand with support 8 to 9 months, 10 months stand without support, 11 months walk with support, 12 months it will not walk with us, so it will be walking like bear. You can just remember walk like bear, WALK like BEAR. So 12 words, 12 letters. So by 12 months, 13 months it will walk without support. So coming to 6-month development, it will babble and mirror play or mirror image. Look at the mirror. So remember mirror, 6 letters, babble 6 letters. And coming to fine motor, is remember the letter locks STD. If you have a phone, STD phone in your house, you will kept it locked, no? So you just remember locks STD. You just put 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. Just put 1 to 2 years, 2 to 3 years, 4 to 5 years like that. So first 1 to 2 years will draw a line. Then circle, cross, square, triangle, diamond. Here diamond you can remember the number of letters. 7 letters. So diamond by 7 years. You can even go back from there. And 7 to 8 years double cross, double line cross, and 9 years cylinders. Again you remember cylinders, 9 letters. So fine motor you can easily remember the word locks STD. You put 1, 2, 3, 4, 5, 6. 1 to 2 years line, circle, cross, square, triangle, diamond. And coming to one more question commonly it will be asked, whether you draw the first vertical line or the horizontal line. You just imagine what you do when you draw a line L. When you write a letter L, first you are going to draw a vertical line. So that is the thing the child will do first. First he will draw a vertical line, then he will go for horizontal. So it can transfer objects from one hand to other hand by 7 months. So transfer, you remember. A child which is sitting with support, when it takes the hand, it will fall down. So only when the child is sitting without support, it can transfer objects from one hand to other hand. So a child is going to sit without support by 7 months, as I told you earlier. So it can shift things from one hand to other hand by 7 months. So 7 months is an important period where you have stranger anxiety, period of negative sum. Until 5 months to 6 months, whatever you do, you get ask them back, it will give to you. But by 7 months, from 7 months onwards, it will not give it to you. It will resist from being pulled away from the mother, or resist things to be pulled away from the hand. So 7th month is called period of negativism. That's the reason why you have to start complementary feeds before the period of negativism starts. That's by 6 months. If you start the complementary feeds by 7th month, it will split, it will refuse the feeds. So by 8 months, you just remember the letter 8, no, you can cut it to 2 equal halves. Wherever you cut, no, bilaterally symmetrical, 2 equal halves. So bye-bye, tata, mama, tata, bye-bye, mama, everything. The child will say by 8 months. You remember easily, all these things can be cut into 2 equal halves, like 8. So by 8 months, the child will do all these things. Bye-bye, wave bye-bye, say tata, say baba, mama, tata, all those things. So 9th month, pincer grass develops. You just remember this like a pinching. So immature pincer grasp. First will be immature pincer grasp, where the whole index finger and the thumb will be touching the table while picking up the things. And by 10th month, by the tip of the index finger and the thumb, they can pick up. So mature pincer grasp by 10th month. And here you can remember one more thing. Suppose remember that 1 is a bottle, this 0 is a pellet. It can pick up the pellet and put it into a bottle by 10 months. So mature pincer grasp, by that it can pick up a pellet and put it into a bottle. And now it can stand alone and play peekaboo games from 10 months. So from here, you can remember certain milestones by counting the bold letters. You just have a habit of having the bold letters. If you have that in your mind, it will be easy for you to remember 50% of the milestones. Other 50% of the milestones, you can just read it. So by 1 year, just 12 months, it will try to imitate words and imitate sound. And it is, as I told you, walk like bear. So just add the letters, it will be 12. Also, it will repeat the sound. When it's imitating the sound and words, it can repeat the sound. It can hold objects, throw objects on floor. It's called casting. And it can enjoy playing. So the students, you remember these words. It will be easy to remember the milestone. Will not make gross mistakes. So holds objects, makes sounds, throws objects, enjoy playing, all this by 1 year. Then release object on command by 13 months. It can hold object by 12 months. By next month, it can release object. Remember like that. So index finger approach. And walking, as I told you, walking without support by 13 months. And it can say single words. So just remember the word independently. So it can walk independently by 13 months. It will ask by pointing. If it wants something new, it will ask by pointing by 14 months. And by 15 months. 15 months and 18 months is very important. 15 months, it will fall by collapse, falls by collapse, creeps upstairs, kneels with no support, and it cannot stop suddenly. When child is walking, it cannot stop suddenly. So these points to remember. And in the fine motor, it can imitate scribble. Imitate scribble comes at 15. Feeds self with no help by 15 months. And childhood jargon. Remember 15. You just add these letters, no, it will be 15. So you can easily remember a child will have childhood jargon by 15 months. So domestic mimicry. Again, this is 15 letters. Just add these letters with 15. Imitates dusting, washing, cleaning, sweeping. All these things, it comes as 15 letters. So a child with 15 months can mimic the mother in washing, cleaning, cooking, all those things. And also by 15, from 15 months, it will indicate wet pant. By 18 months, they can walk carrying a doll and seats self on a chair, jumps with both the feet, and builds a tower of 3 to 4 cubes. As far as number of cubes is concerned, I will give a clue later, so it will be easy for you. So just remember, jumps with both the feet by 18 months. By 18 months, find one spontaneous scribble and imitatively strokes. And as far as the book is concerned, it can turn pages in bunches and say 2 to 3 pages at a time. And it will pointing to a picture like a car, dog, cat, like that. So you just count these numbers, it will come as 18. You remember easily, 10 pages in bunches. And speech and language in 18 months, it will point to the eye, nose, ear. And it will obey simple command. This point you remember, obey simple command. And it will enjoy nursery rhymes and attempt to sing a song. And many intelligible words, say uses 60 to 20 recognizable words. You just remember by 18 months, that's multiple of 6, no? 6 into 3. So 6 to 18 words also you can remember. 18 months, 18 words. So it will be using many intelligible words. Say, this also you can say as 18. So 6 to 20 you can remember. And have sustained interest. So previously, it did not have sustained interest. The interest will be very here and there. But in by 18 months, the interest will be sustained. And they will try to explore the environment. And it will hold the spoon and feed self. Takes off the shoes and socks. And it will dry by day. Tells the mother about the wetting. And it will obey simple command, like close the door. By 2 years, 2 feet at the same step. That is, walk 1 step at a time. When it walks upstairs, 2 feet at the same step. Remember that. So 1 step at a time. So it will walk, climb, and runs, and goes up and down stairs alone, walks backwards in imitation, and picks up the object without fall. And fine motor is imitates vertical and horizontal strokes, and turn pages singly at one time. See, remember that 1 year and 2 years. 1 year, 2 pages at a time, but 2 years, 1 page at a time. So it's 1 page at a time. Just reverse. 1 year, 2 pages at a time. 2 years, 1 page at a time. So speech and languages. It can speak simple sentences by second year. Yes, yes, yes. And 2 to 3 word sentences. And it uses me, he, all those things. And can follow simple instructions. So you can easily remember simple sentence by second year. 2 word sentences. Uses me, he, all those things. So social and adaptive points to objects when named and points to picture when named, like nose, eyes, like that. Enjoys simple stories or songs, imitates others' behaviors, wraps up doll and put it on the bed. Parallel play. So 2 persons, remember 2 years, 2 persons. When one person is doing a play, this will imitate the same thing. So it's a parallel play, 2 persons playing. To play with the others, watching them. When they do something, this also will do the same thing. And puts on and takes out the schools, as I told you already. So even you can remember like this 1, 2, 3, 4, 5, 6. This. So by 2 years, climbs upstairs one step at a time, tells the book by 1 page at a time. 2 feet at the same step. Incomplete man, add 3 parts. Digit counts 3. Picture card names 3. Good enough man test 4. Prepositions obeys 4 simple orders and names 4 common objects. Points 4 parts of the body. Obeys 4 simple orders. Picture points to 5. Tower of 6 to 7 cubes. So even you can have by 2 years, when I ask when somebody asks the questions, what are the development of 2 years? No, you can remember 1, 2, 3, 4, 5, 6. It will be easy for you to remember 1 step at a time, 1 page at a time, 2 feet at the same time, step and digits 3, picture card 3 like that. So it will be easy for you to remember. So 3 years. See 3, you can remember all 3. Age, 3 letters. Sex, gender, boy or girl, 3 letters. Feeling side, 3 letters. Basic color, 3 colors. Tricycle, 3 wheels. Can climb stairs with alternating steps. You just put 3 lines. So there will be 2 steps. This is one step, another step. So it can climb stairs with alternating steps. Like we are walking now, one step, the next step is the next step. Next feet is the next step. Build a tower of 9 cubes. This 3 into 3 cubes. They can copy a circle. As I told you, locks STD, no? Like that. It can copy a circle. Can dress and undress himself. So dress on its own. Now, small thing you can remember, which one of my co-examiner told me in Karnataka. A boy riding a tricycle wanted to avoid urine. So now he knows the gender. He can ride a tricycle by 3 years. He can have bladder control by 3 years for day and night. Now he walked upstairs with alternating steps, saw a girl standing there. He felt shy. Then he went into the toilet and undressed and avoided urine. So with this point, you can remember all the milestones of 3 years. Gender, he knows the boy or girl, can ride a tricycle, bladder control for day and night to be present. He can walk upstairs with alternating steps. He will feel shy. He can undress himself and he can avoid urine. So 3 years fine motor. So what are things he can do? Remember all these 3. 3 into 3 cubes tower. He can cut with scissors. And he can pull a big toy. And he can one or more bridges of 3 cubes. He can put a 3 cubes and construct a bridge like that. So 3 years, remember 3, 3, 3, 3, it will be very easy. Age, sex, 3 basic colors, tricycle, field size, can cut, and a big toy, and a tower of 3 into 3 cubes, like that. And it can imitate a bridge. So speech and language, make sentences with 2 or 3 words, and speaks 3 word sentences, and ask what, why, where. And can say the name, sex, and age. So by 3 years, you can ask what, where, why, and can say 3 word sentences. And I already told you, red, blue, green, 3 colors, and dry by nay, shares and plays with the third persons. Again, 3 you remember. It will share things, play with the others, the third person. So affection to the younger siblings, that's third person. So these all things will happen in 3 years. So 3 years it will be easy, and most of the character will develop by 3 years. Most of the character will come and develop. Our characters, adult characters will come by 3 years. So it can walk, run, climb, kick, jumps easily, recognizes and identifies common objects and pictures, can turn around the obstacles, descends in the stairs. No, it can descend with 2 feet at a step, and feeds himself the expressions of affection. 4 years, it will runs or can turn without losing balance. So 4 years, remember 4 words. Now remember, when a child can stand on one leg like this, it is by 4 years. See, stand with one leg on 4 years. Remember, you see from one side of the child, you can see like this. You can see the number 4 here, no? So a child can stand like this by 4 years. Momentarily it can stand by 3 years, but stand well by 4 years. So this is a clue you can easily remember. A child can stand on one leg by 4 years. And draw a man with 4 parts. Handedness evolves by 2 years, but gets established by 3 to 4 years. Can copy a square with 4 equal sides. Can copy a square. And social narrative, it can tell a story and it can wash face. So remember, tell, wash, or face. 4 to 5 years. Again, 3, 4 letters, climb 5 letters. It can climb tree by 4 to 5 years. It can throw accurately, catch a ball, dress without supervision. All these things you remember 5 letters. So by 5 years, a child can throw accurately, it can catch a ball, and it can dress without supervision. So coming to tower of cubes, you remember 1, 2, 3 age. So 1 year, 1 into 3. 2 years, 2 into 3. 3 years, 3 into 3. So tower of 3 by 1 year, tower of 6 by 2 years, tower of 9 by 3 years. This is for easy remembrance. Cube, remember 3 per year. So this, even from 15 months, they will be able to play with the cubes. So as I told you, 1 year, 3 cubes. By 15 months, it will be tower of 2 cubes only. And 18 months, I told 1 year, 3 or 4 cubes. 1 year, 3 means, by 18 months, 3 or 4 cubes. 1 into 3. By 2 years, as I told you, 2 into 3. 3 years, 3 into 3. And after that, it will be imitating bridge. See, it is very simple. Just see the marker. This is on cube. This is on cube. We'll keep one more cube like this. So it will imitate a bridge like this. So then it will copy the bridge. So one point to remember, first it will imitate, then it will copy. Initially imitates, consequently after few months it will copy. So remember this. So coming here, it will imitate bridge by 3 years, 3.5 years copies bridge. Then 4 years imitates gate. Gate is 4 letters. Remember, by 4 years it will imitate gate. 4.5 years copies gate. And 6 to 7 years can make steps. By using cubes, it can make steps. So tower of cubes, it will be easy for you to remember. Initially it will be with 2 cubes. Before that, it will be catching with 1 cube. It will take 1 cube. When it develops the pencil grasp, say by 10 months, it will catch 1 cube. 15 months, 2 cubes. 1 year, 3 cubes. 18 months, 3 to 4 cubes. 2, 3 into 6. That is 6 by 2, 9 by 3. Then it imitates the bridge. First imitates, after few months, 6 months, it copies. Then imitates gate, then copies gates. By 6 to 7 years, it can make steps. Then, as I told you, 7 years, it can copy a diamond. 8 years, double-lined cross. And by 9 years, it can copy cylinders. 10 years, it can copy a cube. As I already told you, logs STD. Put as logs STD 1, 2, 3, 4, 5, 6. You put 1 to 2, 2 to 3, 3 to 4, 4 to 5, 5 to 6 lines. So 1 to 2 years, it can copy a horizontal line and can copy a circle and cross, square, triangle, diamond. By 6 years, it can draw a hexagon. Hexa, 6, you remember. 6 sides. 7 years, kite. 8 years, as I told you, double line cross. 2-lined cross. 9 years, cylinders. 10 to 11 years, copy a cube. This is coming as far as fine motor is concerned. Then coming to feeding, 7 months, they will be chewing. So that's the reason why you start complementary feeding by 7 months, after 6 months. So that chewing movements will come from 6 to 7 months. So remember 7 letters, chewing. And by 12 months, it can hold objects such as spoon and cup. 15 months can drink from a cup. And 18 months, feed himself by spoon. If you remember the bold letters, it will be easy for you to have a clue for this, all these things. Can drink from cup, 15 months. Feed himself by spoon by 18 months. So while we write the letter L, first we will make a vertical stroke and then the horizontal. Remember that? So child will develop the vertical stroke by 18 months and then the horizontal stroke. So remember this. So as far as the book is concerned, 15 months it will show interest in the books. 18 months can turn 2 pages of a book at a time. Turns 2 to 3 pages. By 2 years, as I told you already, 1 page of a book at a time. So this is a book, handing a book. 1 year, 2 pages at a time. 2 years, 1 page at a time. Remember this. So number of orders obeyed. So they will obey 2 orders by 2 to 3 years. 3 to 4 years, 3 orders. 4 to 5 years, 4 orders. So this some examiners may ask you number of orders obeyed by what age? No? So 2 to 3 years, they will obey 2 orders. 3 to 4, 3 orders. 4 to 5, 4 orders. Thank you very much. So I have given a lot of clues for you to remember, and there are some more clues also, but it will be too much for you in a single class. So I have given some easy clues. So I hope you just go and recollect all these things. It will be easy for you to remember. No, because many students were saying it's very difficult to remember the milestones. So even I was finding it difficult when I was a student. No, so then I just worked on this, and I just realized that we are doing daily what a child do over a period of 1 year. So first you open the eyes, then put a smile, intestine surroundings, head control, neck control, turn in the bed, sit with support, stand with support, walk with support, walk without support. So these are the important things you should remember. Any delay in the first year of life, if you diagnose earlier and give very good therapy, the prognosis will be good. The later you diagnose, the prognosis may be bad. Say, for example, hypothyroidism. The more you delay diagnosis, the more the problem with the child to develop normal intelligence. So up to 1 year, it is very, very, very important. Any small delay you should identify. No social smile by 2 months. Then you just nowadays you be careful, no, with all this autism, everything, no, and also blindness, visual problems, lot of things you should suspect. So up to 1 year, daily repeat when you get up from the bed. Just put 1 to 3 for like that. You will never forget these things. Under 3 years, that is on deadline. So almost all the characters the child should develop by 3 years. So I have given a clue for all these things for you. Age, sex, size, tricycle. So all these things. It can cut something. It can play a toy. All those things. It can play with third persons. Take care of. I mean, it will be interested in third persons like youngsters, younger siblings. So all these things to remember. For motor delay, ask to stand on 1 leg by 4 years. You can just identify. So all these things. So I hope the class was useful for you. If there's any doubt or anything, you can just call me. We'll meet you in the next webinar. Thank you very much, all of you, for attending the class. Thank you.
Thank you so much, Dr. Lakshman Swami. It was a very informative session, sir, from your side. Also, sir, there are a few questions that has been asked by a student, so I'll ask you this question by myself.
Okay, sir.
Just hold on. Sir, there, how do we calculate development quotient, sir?
Sir, how do you calculate?
How do we calculate developmental quotient?
Sir, developmental quotient, nothing. I told you, sit with support is by 6 months. Suppose the child is 1 year old, then it is 6 by 12. So it will be 50%. It's very easy. What the child has achieved now, you put the corresponding chronological age. For example, child is only sitting with support now, not able to sit without support. So the developmental age is 6 months. Now what is the age of the child? Suppose it's 2 years. Then put as 24 months. So 6 by 24, it comes as 25%. So it is very
Okay.
easy.
Okay. Another question that student is asking, sir, how ethnicity affect child development?
And sir, that definitely it will be affecting, sir, because you say in some hilly areas, tribal areas, no, sir, the children will be left outside and they'll be independently moving here and there, no. So the balancing everything will be earlier for those people. They'll be climbing the hill and coming down the hill and all, no. So those people will be having some motor milestones earlier. Also coming to mental milestones, uh, from well-educated people, they will be having a little more earlier development. So definitely ethnicity is going to affect the development. You have to give consideration for that. Coming to the intelligence part, in the tribal area, the intelligence part will be a little bit delayed. So all these things you have to take into consideration.
Okay. One more thing, sir. Somebody is asking, how important are the milestones how important are milestones?
So it is definitely important, no, sir, because see, for hypothyroidism, there will be delay in motor milestones, also speech, then smile, social smile also be delayed. So lot of conditions can be diagnosed earlier. Any hypoxic brain damage, the milestones will be delayed. Suppose there is motor problem, suppose muscle weakness, only motor milestones will be delayed. Intelligence will be normal. For example, in a preterm baby with hypoxic damage, only the lower limbs will be affected, but intelligence will be normal because cortex is not affected. The cortex will develop only after the insult. So the cortex will be normal, intelligence will be normal. So this will be helpful in diagnosing a lot of conditions. In a cerebral palsy, infantile diplegia, intelligence will be normal. UMN signs will be, upper motor signs will be present in the lower limbs. So the child will not be able to walk, but he will be speaking normally. So like this, you can just put the child is not able to speak with us, communicate with others. Think of autism. There the there will be no motor delay, but only speech delay will be there. So definitely, the milestones will be helpful in finding a lot of conditions. Also, degenerative disorders. A child which is able to walk, slowly not able to walk, not able to stand, then not able to sit, it is going backwards. Then you have to think of degenerative disorders. So milestones is
Yes, sir.
very important in pediatrics.
Okay. Another question is, what do you mean by obeying commands, and what is the significance of number of commands obeyed?
So I can't follow. So what is the meaning of
What is meant by obeying commands, and what is the
obeying
significance
commands?
of number of commands obeyed?
So actually, obeying commands is you take that cup and come here. This is one command. Take the cup, fetch, fill it with water and come here. This two command. Take the bucket, fill it with water and keep it in the garden. So like this, the number of commands, when you increase the number of commands, they will obey. By 1 year, if you say take the cup and fill it with water, he will not go and fill the water. He will bring the cup here. So this number of commands is very depend upon the number, depend upon the age.
Okay. Sir, there's another question is, if a child is not speaking for 3 years and has delayed
Hmm.
speech, does it affect
Okay.
the growth and development?
No. See, the growth, so development means mental development will be affected, sir. The speech and that part, speech and language will be affected, but other things will not be affected. Motor,
Okay.
fine motor. So in social adaptive, maybe because of lack of communication, there will be some pitfalls, but the growth and development as such it will not be affected, sir. Only the
Okay.
thing is social communication will be affected because they are not able to speak, no, they cannot communicate. But others they can play, it can do, run, all those things it can do.
Okay. Another question is, sir, what is the difference between deviance and dissociation?
So deviance is that is it is deviated from the normal. Dissociation is actually if child is running means it will fall down during running or it can't. So the normal thing will be dissociated. it can lift the leg, it cannot place it normally like that. Normal thing will be dissociated, but deviance is totally deviated from one side. So the development is suppose the child is not able to say stories, it is only saying some, for example, autism. The child cannot communicate, it will not see others. It will just playing with the bus singly, it will not mingle with others. So it is playing normally, but it's deviated from normal. But in dissociation, they will not be able to play. The normal thing will be affected.
Okay.
Okay.
The question is, should we calculate DQ separately for each domain or together for all domains?
No, sir, you can do it separately. See, to say global developmental delay, you should have two or more. So for each thing, you can put as developmental quotient.
Okay. Another question is, just hold on, sir. I'm just giving you another question. Another question which is coming is, what does the corrected age mean?
Sir, suppose the preterm child is delivered by 32 weeks. So it is delivered before 2 months. So now the preterm baby is by 6 months. It should be considered as only as 4 months. When it's compared to the term baby, the milestone should be considered only for 4 months. If it is developed for 4 months, it will be okay. So how much preterm you deduct it of the post-term age, so that suppose both the babies, term and preterm baby, are 12 months, but the preterm baby is delivered 2 months before or 1 month before, then it should be considered as 11 months or 10 months only. This is called as corrected age.
Okay. And does mental age and corrected age both are same?
Sir, okay, sir. No, mental age means again, mental age is again that can be decreased. In a preterm, mental age can be only for 10 months. Both the babies are 12 months post delivery. The mental age can be only 10 months. It is considered as normal. Both motor and mental development can be delayed in preterm. So whenever you consider preterm babies, you just have a corrected age only. You
Okay.
not say by 1 year child has not walked by 30 months it has not walked without support, it is abnormal. It can walk without support by maybe 14 months or 15 months, but usually the catch-up growth will occur by 1 year. So, but it can occur even up to 1 to 2 years, but mostly they will occur by 1 year.
Okay. Thank you, sir. Thank you so much for a lot of questions, answering a lot of questions, because students are very curious to understand that. Also, sir, I would like to, say here to all the attendees that as you are the, chief author of the one of the best-selling books on pediatrics, which is Clinical Pediatrics, History Taking and Case Discussions, and we have recently released a new edition of the book. So, Walter Kluwer is providing additional discount on Amazon for this book for the next 7 days.
Okay.
So,
Okay.
so this is an additional feature that we are giving. We are providing additional discount for this book on Amazon page. So you can just go to Amazon and buy the book for the next 7 days. This offer is valid.
Sir, for the benefit of the students, sir, I have written 3 books. Sir. One is our textbook of pediatrics and clinical pediatrics by Walter Kluwer, and another practical pediatrics for X-rays, instruments, all those things, sir.
Sure, sir.
So
Sure.
those are interested, they can see all the 3 books.
Exactly, sir. Also, sir,
Okay.
from Waters Clover, we will keep on providing, such informative webinar in the near future. And I would like to thank
Okay.
Dr. Lakshmana Swami, who has taken his time out, busy schedule. Like I've been talking with since morning, and he's been very busy today, but still he has taken a time out and conducted this wonderful session for our students today, or for our attendees today. Also, I'm thankful to all attendees who have been, patient enough to listen to all this important topics and important milestones, to be learned by the students on this particular subject. Well, thank you so much for the great evening, sir. Thank you so much, Dr. Lakshman Swami, again from Walters Kluwer behalf.
Thank you, sir. I'd like to thank all the students who have attended, sir. Thank you, all doctors.
Thank you so much, sir. Thank you so much. Have a good
Thank
day.
you, sir. Thank you. Thank you, sir.